Hello, everyone. Welcome to the latest edition of the CL Derm Cosmetic Laser Dermatology webinar series. Today, we are very excited to have Dr. Douglas Wu with us. He is going to be speaking about brown spots and red spots, with a lot more better terms than that, but basically all the different treatments that are available, specifically laser treatments, to even out our skin tone to remove all the different pigmentations, including the brown and red. So I am very excited to introduce Dr. Wu. Hi, Dr. Wu.
Hey, Risa. Hey, guys.
Dr. Wu, if any of you don't know him, is a very incredible board certified dermatologist. He's very experienced in all types of cosmetic dermatology, from injectables to lasers to body sculpting of veins, even though today he's going to be speaking mostly about lasers. And of course, at Cosmetic Laser Dermatology, we do have 6 board certified dermatologists. All of them are more than capable of doing the procedures you're going to hear about today from Dr. Wu. So we hope you find this educational and informative. At the end of the webinar, we will have time for questions. So I encourage you to add any questions to the Q&A feature as they come up. So without any further ado, Dr. Wu, let's get right to it.
All right. Great. Well, thanks for tuning in, guys. So today I'm going to be talking a little bit about probably the 2 most common things I get asked about when people come for consultations about their skin: brown spots and red spots. Discoloration of the skin is very, very common, and it is probably the most bothersome thing that can happen. And the most common issues are due to sun exposure. So let's kind of go through some of the causes and treatments for these types of problems here. So first of all, we'll do a little bit of a brief sort of talk about how lasers actually work, and then we'll go into brown spots and all the different kind of causes of brown spots, why we get them, how we can treat them, and then broken blood vessels or redness of the skin, and what causes this and how to potentially correct it. So very briefly, when we talk about the skin, we have basically 3 layers to our skin. There's the very top layer, which is called the epidermis. There's the middle layer, which is the dermis, and then there's the fat underneath it. Most of the time, our lasers are treating the top 2 layers, okay? And the lasers are actually very cool because they work by targeting very specific molecules in the skin, including pigmentation, which is kind of brown spots, blood vessels, which give rise to redness and red spots and all sorts of other things, and then water, which comprises most of our skin. These are the 3 things that lasers target, and they can target them very, very specifically because of their wavelength, which is all the colors essentially of the rainbow and beyond, as well as various other laser parameters that we call fluence, wavelength, and the size of the laser beam itself. All of these things kind of combine in order for us to sort of be able to target all of these structures in the skin and make some sort of nice result come out of it. So if you look a little bit closer, what happens actually to a brown spot when we hit it with a laser? Well, in simple terms, after the laser hits a brown spot, it breaks that pigment that is large and sort of visible. It breaks it up into really small pieces, so it becomes less visible, and then it can just be kind of shed or absorbed by the body. On the other hand, when the laser hits a blood vessel, it actually shrinks that blood. It heats it up, essentially, and then when it gets heated up, the blood vessel collapses. And after it gets collapsed, it just disappears because the body absorbs it. And then finally, when we kind of talk about skin texture and stuff like that, we kind of heat up the water, and that heat gets transferred to the cells and stimulates collagen and all this kind of good stuff, and that kind of rejuvenates the skin. But we're going to be focusing on brown spots and red spots today, so not really about that water part. So let's talk about brown spots, because there's tons of different types of brown spots that can actually present in the skin. And most of the time when, when I get consults for this problem, the very first thing I need to do is determine exactly what's going on. So the many varieties of brown spots, the most common are probably the simple freckles, the simple sunspots, and the so-called keratoses, or these are those rough little barnacle-like spots on the skin. There's a special variant of this barnacle called dermatosis papulosa nigra that presents typically in darker skin tones, and these are the really small black little dots usually tiny, but they can be numerous and quite concerning. Melasma is extremely common, and this is something that affects mainly the cheeks in women, sometimes the forehead, the upper lip, giving sort of like a mustache type look that nobody really likes. And this is a birthmark, a so-called cafe au lait macule. It's just a flat brown sort of thing, usually there at birth, totally benign, but also can be cosmetically located in suboptimal location. And then, this is another birthmark. It's called a nevus avota, but it's usually this blue or grayish kind of patch on the cheek that, most people don't really like the look of. And then finally, you can actually get these brown spots or hyperpigmentation from injuries. So like this is a laser burn, for example, causing this darkening of the skin. You can get medications that actually cause pigmentation to accumulate in the skin. And then you can get these deposits of cholesterol and fatty tissues underneath the eye. There are these yellowish, brownish kind of spots that we call xanthelasma. And then, even trauma or injuries of any sort can cause this type of pigmentation. So when we talk about brown spots, it's not really just sunspot. It's honestly a huge range of different conditions. And it's actually important for me as a dermatologist to distinguish between these conditions, because many of these conditions will respond differently to different types of treatments. And so that's why it's nice to have that little bit of derm background in order to treat these. So how do we treat them? Well, it's 4 basic steps. The first step is we need to correctly identify exactly what type of brown spot we're treating. Okay, that goes without saying, and it's very, very important. And if we do not do that, then it tends to just be, a very non-specific type of treatment. It may not be safe. It may not be effective. So this is step number 1 always. The second is using that knowledge of the identification, we then select the optimal treatment method. In this presentation, I'm just going to be talking about laser, but there's all sorts of different types of treatment methods. And to be honest, most of the time, combination treatment methods are the best. Finally, we select the right laser, and then we have to, this is critical, probably the most important thing is to use the laser in the right way. Okay, because that's where really all the magic happens. And then finally, after we've cleared the spot or treated the lesion or whatever it may be, we need to really think about strategies to prevent them from coming back, so that this result can be maintained for as long as possible. So let's go into a few sort of conditions. My favorite technology these days to treat brown spots is the so-called picosecond laser. We have 3 picosecond lasers at our office, and I use all 3 of them in combination to treat a huge variety. Probably every single brown spot, quote unquote, that I've shown so far can be treated in some form or another with a picosecond laser. But that's not to say that's the only laser that works. There's actually a large list of lasers that can work for brown spots, and these include things like the Alexandrite laser, the IPL, the Clear and Brilliant laser, Fraxel, and many more, most of which that we have here. And there are times when I will select these other lasers if the situation calls for it. And like I said, combination of these laser modalities often yields the best results in the fewest number of treatments. And that's actually important because nobody wants to come in and get laser all the time, right? There's costs and time issues and stuff like that. So if we can really get the maximum result with the minimum number of treatments, that's the holy grail. So as you recall, this is what the laser does. It shatters up the pigment. Benign freckles. This young woman had these little spots on her nose, very, very common. And they're not super visible, but they bother her. And some people love their freckles, some people don't. Personal choice, but for those who don't, they can be removed by laser, and it's a very safe and effective treatment. Similarly, in this situation, she has more sort of larger spots to kind of the bilateral cheek, a little bit on the nose bridge. Once again, some peak away laser, a little bit of Clear and Brilliant in this case as well, managed to blend those away. And this is a more diffuse situation of freckles that kind of spot over the whole face. But once again, with a little bit of laser treatment, these can be really nicely removed. And then finally, this is probably the most severe case of freckles that typically would present. There's just more of them, and they're confluent, but they still respond extremely well to the correct laser done in the right way. This is also a very common situation where we get kind of darker skin tones, which are much more sensitive to laser in general, and so we have to be much more selective in the types of lasers that we use and the sort of ways that we use them. But even in very dark skin tones, if you use the right laser and use them the right way, it's very safe and very effective. Then there are the larger, sort of patchier kind of sunspots, what we call the lentigines or the keratoses, very common in ethnic populations, but also in all skin types. We can get these dark brown sunspots. They usually don't look great, and so most people want them to go away. But with laser treatment, as you can see here, they can essentially completely vanish. And often that result can last for a very long time, often years, and it may creep back slowly over time, but usually not to the same degree that it was at baseline. Here, the bilateral cheeks, very, very common area to get these sort of sunspots. And after some laser treatment, you can see that it's much improved. And then, this is a combination of different types of things. There's some flat little sunspots. There's these raised little keratoses, a few freckles spotted in there, but also just like the skin tone, it's a little bit dull. The pore size is a little bit enlarged, some fine lines and wrinkles and stuff like that. This is all the sorts of things that laser can target and improve and or correct or remove, as you can see in this situation here. This was a sort of an older gentleman, with a very fair skin. So we have the luxury of choosing, almost any laser that we have and still maintain a good safety level. But these are thicker, sort of barnacle-like spots that we were able to really clean up on this guy. And, he was very pleased with that. Birthmarks. We treat a lot of birthmarks here, and there's a large variety of different types of birthmarks, but the brown types of birthmarks tend to be these things called cafe au lait macules, which are sort of coffee colored, essentially, and they're usually these round, well circumscribed, either oval or irregularly shaped spots that can pop up anywhere, basically, and are almost always benign. In a very small number of cases, they can be associated with other medical conditions, but that's usually not the case. But for purely cosmetic reasons, these spots can be very effectively removed with laser treatment. And I find the Pico Wave being one very effective laser, but any so-called short pulse laser, like a Q-switch laser, usually can do the trick quite well as well. Here we have one that, just was located in an unfortunate location just by the eye there. And it took several treatments to get this one to go away, but eventually it did, and it looks much better. This is also a very common type of birthmark, especially in Asian patient populations, actually, where you get this bluish, grayish kind of patch on the cheek, sometimes extending up into the forehead, and even sometimes into the eye. You get this dark swirl in the whites of the eye, and it looks quite interesting. But this is what's called the nevus of Ota, and the reason why it's blue-gray is because the pigment cells are just much deeper in the skin, and so they reflect light a little bit differently, and they therefore turn blue. But even these ones deep in the skin, if treated in the right way, they can actually go away with laser treatment, and that effect is essentially permanent. They never really come back after they've been treated appropriately. Xanthelasma are, like I said, these little cholesterol deposits underneath the eye. I'm not sure if you can appreciate, but there's that yellow plaque kind of underneath the eye there. That is treated and disappears. As a knock-on benefit, there's these sort of sunspots and freckles underneath the eye as well that laser has cleaned up significantly. But on the other eye, these are almost always on both eyes. They can happen on the lower eyelid or on the upper eyelid or on both, and they can be quite unsightly, although they don't represent any. Usually, they don't represent any sort of health risk. But laser can be really quite effective. This was just one treatment. There's still some remnants of it after it all is said and done, but it can be treated again and probably 100% removed. Then you have these very interesting things where you take like a medication and suddenly you get either a pigmentation or some discoloration because of your medication. This is what we call drug-induced hyperpigmentation. One of the classic examples is for when you actually eat silver compounds because of, some people believe that there are health benefits to ingesting colloidal silver. But if you ingest too much of it, you actually turn blue. Your skin all over can turn a deep blue color. It's really quite striking. But interestingly, when you use the laser, you can actually remove that blue color, and you turn back into normal skin color. So this I just showed as a fingertip because it was interesting. We treated through the nail plate itself to treat this blue discoloration, and it vanished almost immediately. But this certain individual, he was actually blue from head to toe. It was quite striking. Similarly, some antibiotics, especially antibiotics that are used to treat acne, they can cause a dark, bluish, grayish kind of pigmentation that forms within the acne and the acne scar itself. And this is a very classic form of drug-induced hyperpigmentation that can also be treated with laser. This patient still requires specific treatment for his residual acne scars, but you can see that the dark discoloration, at least that has been resolved with laser. Injuries. This young man, worked in a labor-intensive job, got some injuries to his shins, and resulted in hyperpigmentation of African-American background. So his skin type was predisposed to this kind of problem. With a little bit of laser, we were able to clear that up pretty nicely. And this young man, unfortunately, suffered some laser burns. I believe he had some treatment performed in Dubai, and unfortunately, a mishap occurred, and it was really quite disfiguring to his skin to have these stamped sort of burn marks all over his face. However, fortunately, we were able to reverse most of the damage. This is really quite a severe situation, and the outlook can sometimes be really grim. But in this situation, with some time and patience, we were able to reverse the situation, so that was good. And then there are the combination cases. You got some melasma, some sunspots, and everything in between, all of it going on at once. These are very tricky to treat because some forms of pigmentation are going to rebound and get worse, and etc. You have to combine creams and sun protection all the time in order to get the best result. But if you follow the rules and do the right thing at the right time, then usually you can get a pretty reasonable result. And laser plays usually a very large role in achieving that. So these are all cases of mixed pigmentation with melasma and other conditions happening all at the same time. And these were all treated with a variety of different lasers, picosecond laser, fractionated lasers, Q-switch lasers, stuff like that. So that's brown spots, essentially in a nutshell. Almost every common condition that presents to us that can be considered quote unquote brown or somewhat brown in discoloration. Next, we'll talk a little bit about broken blood vessels or redness, because redness is a really big concern as well. I get a lot of patients coming in because they're red, okay, for whatever reason, they're red. And so I'm going to go through some of these causes and some of the treatments that we can offer. So broken blood vessels, that's kind of the colloquial term that many people use to describe a variety of different conditions, including truly broken or dilated capillaries of the skin, like in this case here. There can just be a diffuse sort of redness, like a sort of rosacea type condition. Acne itself is a very red-inducing condition. And then there are these specific little vascular lesions, like these cherry angiomas, for example, or these hemangiomas, often on the lip. You get these purple to bluish kind of nodules, and then even these so-called pyogenic granulomas, which are even larger kind of nodules, often found on the lip as well. And then there are birthmarks. Vascular birthmarks there are many different types of vascular birthmarks, and this is probably the most common one that we see in our clinic, called the port wine stain, and it causes striking purplish to reddish discoloration of the skin, and it can even form lumpiness and stuff that is really quite disfiguring. Post-injection bruising is another form of redness that we see not infrequently. And then finally, these larger veins, the bluish ones, they're maybe 1 or 2 millimeters in size, and they kind of snake around, usually around the temple or kind of around the eyes, and they kind of pop out when you get angry or are exercising. And sometimes they don't look that great either, and so people come in and want them removed. So these are all kind of the different potential causes of quote unquote redness of the skin. And once again, in order to treat this stuff, I forgot there's even scars. Scars often turn red, whether they be acne scars or traumatic scars like this one here on the top corner there was a cat scratch. Stretch marks often go through a very red, angry sort of phase that can be treated with laser as well. But once again, the principles of treating redness are essentially the same as treating brown discoloration. You really need to identify what exactly is going on, not the brown spot, that's a typo, but really what the type of redness that is going on, because that's going to determine the type of laser that you choose or the treatment that you choose in general. Then you need to, of course, select the optimal treatment method and then use it in the right way. And then finally, again, follow up and do the right steps to prevent or at least mitigate or delay the return of any sort of redness. So let's kind of go through some of the lasers. Vascular lasers are kind of the catch-all term for usually the tool that we use to treat redness. And one particular favorite of mine is called the V-beam, V for vascular, beam for laser beam. But like I said, there are, again, many different tools that can be used. And it's not really about the specific tool itself. It's honestly more about how you use it. And so the intense pulse light is a very classic tool. I love it. I use it all the time. The Alexandrite laser can be used to treat redness. The Nd:YAG laser can be used to treat redness, and many, many other types of lasers and other energy devices can be used to treat redness. So again, combining these modalities sometimes yields the best results, and sometimes it's required actually to get the best results. So let's kind of go through a few things here. Again, just to review, the laser hits the vessel, shrinks it, and then it disappears. Here we see on the lateral nose, a very, very common location for these tiny little spider veins just creeping up in there, and nobody likes that. They're a stubborn thing to treat, but laser can really help to mitigate this problem. And it looks very small and minuscule, but if it's there, it's very bothersome. This is one of the most common complaints that I see. In this situation, it was a little bit more intense. These large sort of broken blood vessels extended all the way to the cheek and even beyond, and laser treatment was very effective at removing that. This was just, I think, one treatment. There's certainly some residual. If you look closely, you can see certainly it wasn't perfect, but one more treatment is going to polish that off pretty nicely. Rosacea is a very common condition, usually due to dilated blood vessels, a little bit of low-grade inflammation to the skin as well. And laser therapy can actually be really quite useful, even for severe nodular sort of lumpy bumpy forms of rosacea. Laser treatment can be really quite effective, or for just the classic sort of flat redness, the laser can really clear that up nicely. And it's life-changing. I mean, rosacea is not just a visual condition where you get redness, which can be socially unacceptable or awkward. Maybe it doesn't look that great, but rosacea can actually be symptomatic as well. The skin feels hot, burning, the eyes can feel dry and itchy. And so, this is a condition that when laser is applied to it, all of these things can improve. And that represents a very large improvement in quality of life, typically. Acne, I don't need to say more about this. I'm sure we've all had acne at some point, and it's very disturbing. It can leave scars, it can look terrible, it can even hurt, it can form nodules, and the most severe forms of acne can actually hospitalize people, believe it or not. And so obviously those forms of acne you're not going to treat with laser, but the standard forms of acne you can treat with a variety of different lasers. One procedure I like to do is called photodynamic therapy, combines a bunch of different lasers and lights, as well as a topical medication in order to achieve this kind of result here. And then similarly, photodynamic therapy can really help to calm down severe acne that is really inflamed. And if we catch it early, we can kind of mitigate the scarring. And therefore, either maybe we don't have to treat scars because they're not there, or if we do have to treat them, we don't have to treat them as aggressively, and there don't need to be as many treatments. So treating acne early and effectively is very important. Laser is honestly not considered first-line therapy for acne. Any good dermatologist should be able to walk you through all of the different options that are there for acne, including topicals and oral therapies, laser therapies, etc. So there's a big armamentarium, but catch it early, treat it well, and you can avoid a lot of heartache in the future. Specific red spots, like I said, these lip lesions, or sometimes called venous lakes or hemangiomas or angiomas, this pyogenic granuloma. A couple laser treatments later, it's like Photoshop. They're almost completely gone. These little red spots on the skin, we call cherry angiomas. They're very common, and they're very easy to treat. They respond extremely well to vascular laser. And again, it's like Photoshop. You don't see anything of them ever again. Now, they don't bother everybody. Most people walk around with a few of these, honestly, and it doesn't bother anybody. But for those that it does bother, this is a very good treatment, and it's very simple to do. Birthmark, like I said, this is the so-called port wine stain. It occurs at birth, and if you leave it long enough, actually, into adulthood and beyond, it can actually grow lumpy, bumpy, and nodular and become bigger and thicker, at which point it's actually very difficult to treat. And so if you can catch it early on when it's flat, then you can achieve a result like this. It's not perfect, of course, but it's certainly an improvement over what was previously there. At the very least, this result is much easier to, apply a little bit of concealer if you want to, right? You don't have to, of course, right? It's your skin, be proud. But if you want to, it's easy to apply a little bit of concealer and cover that up. Then finally, these eye veins, they're very common, greenish, purplish, kind of larger veins that kind of affect the temple region, the under eye region. A little bit of laser is so effective at just blending these away. And it can be really, really nice effect. You see how in this picture here, that vein is actually causing a dark shadow under the eye. It's like this individual looks a little bit more tired. It looks a little bit more hollow because there's that dark purple vein under the eye. And I see this very commonly, a little bit of laser, and it ends up going away. And this is maybe a little bit more severe case because they're more prominent, a little bit closer to the surface. And also in a darker skinned individual, once again, we have to take that into account when we use our lasers because they're much more sensitive and many more precautions need to be taken in order to safely treat something like this. Anything red almost can potentially respond to a vascular laser. So red stretch marks can respond. Although, to be honest, and I think this picture is very honest, you don't really ever get fantastic treatment with stretch marks. It's always a very frustrating condition to treat. Bruising, however, can go away really nicely. So, if you ever induce a bruise, if there are any physicians in the room or injectors, then you can treat it with a vascular laser and it'll go away. And then, of course, there's the acne that I mentioned. There's the scarring. This was a cat scratch, and a couple of treatments later, it's much less noticeable. It certainly is still a little bit indented, and there are maybe ways to correct that, but at least that angry red scar is gone. So we've kind of run through quite a few things. So let's kind of summarize a little bit here. And hopefully that wasn't too boring or hard to follow, but basically these are all the conditions, okay? And I have to really stress that as a medical doctor and as a dermatologist, it really is so incredibly important that we apply that medical knowledge to identify exactly what it is that is going on that is causing either the brown or the red discoloration, and therefore treat accordingly. Because we have to always bear in mind that quote unquote brown spots, although most of the time are 100% benign, there are certain brown spots that are in fact skin cancers. And we have to differentiate, obviously, those because they would be absolutely inappropriate to treat with laser and need full and urgent medical attention. Similarly, with red spots, there are many skin conditions that are rashes or inflammations of the skin that actually require true medical treatment and are not appropriate to be treated with laser. And so therefore, having that little bit of dermatology background allows us to differentiate between all of these different types of conditions and hopefully, therefore, follow the golden rules, know what you're treating, treat it correctly, and then keep it from coming back. So I think that's it. Thanks for tuning in, guys.
Great. Thank you so much, Dr. Wu, for this informative webinar. This was a lot of information. I know he showed a lot of photos and gave a lot of information. I want to remind everyone that it's being recorded, so you can always go back and watch it and look at the pictures a little bit more slowly if you would like. In the meantime, we have a number of questions that have come in. Anyone else that would like, this is the time to add them to the Q&A feature on the bottom of your webinar screen on Zoom, and Dr. Wu is available to answer. So let's get it going. So here's a question. What's the difference between sunspots and melasma?
So yeah, that's a very good question. They're extremely different, actually. A classic sunspot is just a little brown spot on the skin that's usually very well circumscribed, very well defined, usually some sort of circular-ish kind of shape, and responds extremely well to laser. That's a regular sunspot, okay? Melasma is actually a condition. Okay, it's a condition where the pigmentation cells, the so-called melanocytes of the skin, become hyperactive. And this hyperactivity causes patchy, ill-defined pigmentation, usually on both sides of the face, whether it be cheek or forehead or lip. And this condition is actually very tricky to treat with melasma or treat with laser. It doesn't respond that well unless you combine various different types of treatments together in order to get it to go away. So they're very different conditions, but they often, in fact, and I showed a few pictures of this, they very often present in the same person, because if you have melasma, you're almost always going to have a sunspot. If you have a sunspot, you're not necessarily going to have melasma, but they go hand in hand.
Got it. Okay, thank you. So here's another one. I have been told my sun damage in the 80s can make me not a great patient for laser, but certainly you've had many sun damage patients.
Yeah, that's almost want to say that's a common myth, actually. The older skin can actually be treated very, very well with laser. And in some ways, older skin is actually even safer and responds even better to laser. The healing properties of older skin is actually phenomenal. And relatively speaking, sometimes the greatest benefit can actually be achieved when there is a little bit higher level of baseline damage. And so the 80s, 90s, I've treated patients well into their 90s before with no problem. The most important thing is not really the age, but it's what kind of sun damage is going on and your baseline skin type. Those are the two major determining factors in terms of what we can do to treat you.
Got it. Okay. Um, Here's maybe a loaded question. What is the best laser for sunspots?
so um, many different types of lasers have their pros and cons for many different types of sunspots. And so, I personally like, for many different types of sunspots, I like to use the so-called picosecond lasers because they have some advantages over previous generations of technologies. However, there are some disadvantages with picosecond laser too. And so sometimes other lasers would be better than the picosecond laser for certain types of sunspots. And that's why it's so key to kind of determine exactly what kind of sunspot in exactly what kind of patient, so that we can really tailor that treatment to that specific spot. And that's basically the best that we can do.
So how will you recommend to start treating melasma? Do you start with peels and then laser?
Yeah, this is a controversial sort of issue within the medical community. There is no quote unquote right answer. There are many, you could say, viable ways to do it. One and most conservative way to do it is just to use topical creams. Okay, sun protection and topical bleaching creams is a tried and true way to treat melasma. Very low risk. It's usually going to work, but it's not necessarily going to work all that well. But at least it'll lighten it and maybe make it easier to control. Okay, so that's one way to start. Peels are certainly a way to treat melasma. You can do light chemical peels, even medium chemical peels, to lighten the discoloration. And that, in some people view that as even a safer version to laser treatment. And there's an argument for that. Laser treatment is my preferred modality, but only in the situation where the patient agrees to use sun protection and a bleaching cream in combination with the laser, because laser therapy alone for melasma is not recommended, in my opinion.
Got it. Okay, for the last couple questions.
Oh, sorry. Let me just quickly answer that follow-up about tranexamic acid. Um, yeah, so this is a newer sort of treatment for melasma. It's an oral tablet that has been shown in some studies, especially kind of coming out of Asia, to have some benefit for melasma. It can be beneficial, certainly. I don't jump to it right away because, as any oral medication, it has side effects, and some of these side effects theoretically can be actually very severe, even life-threatening. And so that's why I don't jump to it right away, but I have used it fairly commonly, as well, as long as I monitor it and use it in low risk situations in combination with laser and sun protection and creams. It can work wonderfully.
Great. Okay, another question. Is there a standard treatment approach to the removal and remediation of keloids? Combination of surgery and laser, is it successful, specifically on the sternum?
Yeah, keloid scar, one of the most challenging conditions that we treat as laser surgeons. And there is, you could say, a standard. The standard of treatment, or at least the expert consensus guideline, was published about 6 years ago in one of our major medical journals. And in this guideline, we recommended the use of 3 different treatment modalities to combine to treat a keloid scar. Number 1 is an injection. Okay, an injection of a medication that breaks up the scar, flattens it out, and makes it softer. Number 2 and 3 are lasers. Okay, there is a laser. In fact, the V-beam, or the pulse dye laser, has been shown to modify keloidal cells and make them quiescent. And then the second laser is usually some sort of fractionated laser, maybe a CO2, something like that, that further breaks up the scar and makes it flatter. This is thought to be the standard quote unquote way to approach a keloid scar without resorting to extraordinary measures like re-excising it or something like that. Certainly there are scars that will respond to just re-excision, but that's a tricky path to walk. And in terms of how successful any of these treatments are, the thing to understand about scar treatment is that it can be very successful, very, very successful. But the biggest barrier to scar treatment is that it takes time and patience, multiple treatments over a period of time. There's no way to rush it. In fact, if you rush it, it gets even worse. And you just got to go slowly and just chip away at it. But if you do the right thing at the right time in the right way, then it works out very, very well.
And also, any thoughts on when to treat scars, when they're new, years
Yeah.
after?
Emerging evidence is reasonably firmly established that you should treat early. You know, before we used to say, let it sit, let it mature, whatever. But now actually you should treat it early. So, you know, within 2 to 4 weeks of injury or surgery or whatever, you should start treating. And that usually gives the best benefit.
Great, that's helpful. Okay, so I think a question that a lot of people probably have is how long do these results last? And how do you, is this something that you need to repeat every year?
Yeah. So it depends on the condition. So simple freckles and sunspots, they can disappear and hardly ever come back or come back very slowly over a period of years. Okay, so that's with simple freckles and sunspots. Melasma, on the other hand, is going to be a constant battle of maintenance and prevention. Okay, so even with laser, wipes it out, looks great. There's always the chance and a very good chance that it's going to come back. And so that's why we have to really deal with the aftercare very, very assiduously. And then other things like birthmarks, once you treat them, they're gone. They don't come back. Barnacles and that kind of stuff, they don't come back. You can get new ones. And you probably will get new ones, unfortunately, but the ones that are treated are gone. For blood vessels, it's a little bit trickier. So it depends on where the blood vessel is. So, you know, nose vessels tend to come back, honestly, because there's just so much blood supply in the area. We get rid of them for a little while, but maybe a year later, usually my patients come in yearly to get rid of them, and that tends to work pretty good. Other forms of vascular lesions, like these temple veins, for example, they go away and they hardly ever come back. Birthmarks, once you get them to go away, they don't come back. So it really depends on the type of lesion that you're treating in order to determine how long that effect will really last.
Got it. And last question, how effective is skincare to treat these conditions?
Skincare, the importance of skincare should not be understated. I believe that adequate skincare is very important. At the least to accomplish step 4 of the 4 key sort of elements of success, and that is the prevention of this coming back, or the maintenance phase. This is where skincare plays an extremely important role, especially in pigmented lesions, melasma and other pigmented lesions. And so I have all of my patients, at least I recommend, that they all, I design for them actually, a regimen of skincare that will fit their needs and give them the best chance of success for the longest period of time.
Great, thank you. And here's a final little technical question, I think. So if you work with PicoSure for treating melasma, are you combining the different hand pieces together, and what are you recommending for best results?
So I have used a lot of PicoSure for a lot of different situations and treatments. I don't tend to use it a lot for melasma personally. Um, I don't feel that it is necessarily the best option for melasma, but if I were to use it, and it can be used certainly, and if it is the only picosecond laser that I had, then I may use it. Then in that situation, yes, I would combine the zoom, the flat, and the focus handpiece in almost every single situation, and that would be the best way to maximize the treatment.
Okay, some more technical questions. Maybe there's some doctors tuning in. Do you recommend the Pico A532 for Fitzpatrick 1V?
Yeah, absolutely. So Fitzpatrick's types maybe like 4 or 5 or 6, I think the question maybe is asking in terms of darker skinned individuals. And the answer is absolutely yes. 90% of the pictures that I showed were with Pico A532. And you know, the common wisdom actually is that you shouldn't do that. You shouldn't use 532 nanometer wavelength in short pulse laser for skin of color because there's elevated risk of pigmentary alteration and complications. But the picosecond laser, and especially those lasers that have very short picosecond pulse durations, I have found that the safety and the efficacy is such that I can use it in almost any skin type as long as it's tuned appropriately. And you have to use it with extreme caution. And every single pulse of the laser, to watch it and evaluate it appropriately. But yes, it can be done. The safe parameters are entirely dependent on the skin reaction that you see immediately after you fire the laser. It's what we call the cutaneous endpoint. And this is an endpoint that is immediate, that you can see immediately after you fire the laser, and it will guide exactly what settings and parameters should be used with that laser. And with the picosecond lasers, you can actually fine tune those endpoints to a much greater degree than you could with the previous generation Q-switch or nanosecond lasers, which is why I feel that they are much safer and much more effective.
Great. So I just want to remind everyone, I know Dr. Wu has talked about a lot of different lasers and technology. We are very proud that at Cosmetic Laser Dermatology, we have over 50 lasers and devices. So that's one of the reasons why Dr. Wu was able to show so many different effective results, oftentimes combining lasers, as well as treating all different skin types, because you know, these treatments are not all the same for every person, every skin type. So with that in mind, if you do have any brown or red spots that you don't like, Dr. Wu or any of our dermatologists are definitely available for consultations. We're doing in-person consultations with safe COVID measures. We're also still available for virtual consultations, and we would love to see you. Otherwise, Dr. Wu, any final words?
No, I'm very grateful that for anybody who tuned in to watch, and love speaking with you all. And thank you so much for all the questions, and thank you, Risa, for hosting.
Yes, thank you so much, Dr. Wu. Again, this was very helpful. The recording, we will be sending this out over email tomorrow. It was streaming live on Facebook, so you can see it there now. And it will always be available on YouTube and our website. So we hope this was informative and will help you to get to your goals of beautiful, even skin tone. So thank you, Dr. Wu, and please come visit us in sunny San Diego.
Take care, guys. Stay safe. Bye-bye.